the younger generation that, those are the people that you're intubating and you're putting, tubes down their throats to breathe for them. And I think that's that could be you. I mean,
Joanna, thank you so much for taking the time to talk to us. I heard you only had a couple hours of sleep, and here you are talking to us, and I appreciate you so much in everything that you do as a nurse.
Of course, thank you for having me.
Absolutely. Okay, so can you tell me a little bit why you decided to become a nurse?
Yeah, I actually kind of got into nursing later on. I had originally had a degree, and I actually went back to school to get a nursing degree. Just because I wanted more of a patient interaction, which I felt like nursing was definitely, you were at the bedside 100%. And of course I didn't anticipate this whole pandemic to happen, but it definitely gives me such an appreciation for the field and kind of affirms the reason why I went into it in the first place.
So you're currently having to take care of COVID-19 patients?
Mm-hmm. Yep, that's essentially
Wow.
100% of the patients that do come in. So, and even if they don't really come in with COVID complaints, sometimes they do wind up turning into COVID patients.
How intense has it been for you?
Yeah, it's been very difficult to I think just kind of grasp the severity of the situation. Normally our patients, we do have very high acuity patients where they're very, very sick, but now it's just every patient that comes in is, we assign them a level of between 1 to 5, and most of them are, level 1, 2s, and 3s, and that's kind of like the more serious. And now that's basically every single patient that we see is a 1, 2, or a 3.
How have you been protecting yourself? Has your routine changed? I'm sure it has since this pandemic took over. What's it looking like for you?
So now I wear a mask coming to and from work, of course, even going out in public, because one of the biggest things is that even though I may not have any symptoms, I'm around it all the time. So I could be a carrier, and I could be one of those people that are going around and infecting people and not even knowing. So I'm very big on wearing a mask. Coming home from work, I leave all my stuff at the front door, and I, leave my sneakers, my work bag, everything that I basically brought to work is just left at the front door. I have to make sure I separate, any sort of scrubs that I wore that night from my regular clothes when doing laundry. So just kind of taking those extra precautions to make sure that I'm not cross-contaminating anything really at work, at home.
Has the supplies gotten better as far as protective equipment? Because we heard for a while that there was a shortage. Has it improved at all?
I've actually been very lucky in that sense. Our managers have been great with making sure that we have enough masks, enough gowns, gloves. We have enough, and we have a lot of people that have donated masks, people that have made stuff from home, which has really been great to even just be able to reuse the masks that we do have by using the ones that have been made at home. So
what can we, just regular people, do to help you?
I mean, really, it's simple. It's that social distancing. I don't think people really understand the impact that it can have on just slowing the spread of the disease. And like I said, you can be a carrier and you could not even know it. And you go to the grocery store, you go out just for a walk, and you could be, infecting somebody else in that time. And of course you can't stay cooped up forever, but just going out for the essentials. And if you're one of those individuals that's, got some sort of history where you could contract this disease very easily, making sure if you have a friend or a family that can go out and grab something for you to, just kind of really minimize contact.
I mean, in an ideal situation, knowing that it's not, how would you like COVID-19 to be handled?
I mean, it would be great if we can just get a vaccine and just, stop this thing. I mean, it takes forever, but that's really, I think, the main thing that's going to help besides the social distancing is getting that vaccine in.
And this is so much trauma, not just for the patients, but for you, for everyone who's on a frontline, healthcare workers, everyone who works at the hospital, housekeeping, just everybody. It's very exhausting. How are you doing? How's your mental wellness during this?
I'm doing okay. I mean, it's tough. Some days, I think more a couple weeks ago, it was much, much tougher. We had a lot more people wind up passing on us. Young people even. I think that's one of the tougher things to kind of bear because, with the older population, not that you're used to it, but, you almost expect it. Like, their bodies can't take as much. It's the younger generation that, those are the people that you're intubating and you're putting, tubes down their throats to breathe for them. And I think that could be you. I mean, we did it to a 30-year-old patient and someone who's relatively healthy, and that could be your friend, your older brother, your older sister, whoever. So
do you feel that you and other nurses, healthcare workers, have been bonding more during this experience, where you feel they are your support system right now? Or is it just tough where people can't even take that time to really lean on one another?
I think we have been leaning on each other, and as much as our families and our friends, they're great and they're so supportive. You don't really get it until you're there, until you can actually see it for your own eyes. So being able to talk with each other. I mean, I've had not only the nurses but the doctors and the environmental services staff, the patient interpreters that are there. I think everybody kind of gets it. So whenever you need somebody to talk to, somebody's always there.
What would you say is your wish right now for the whole world?
I mean, I hope this ends as quickly as possible. I mean, I feel like it's taken its toll on everyone. I've had friends that have been laid off of jobs and had to apply for unemployment, and it's tough. And then, I've had friends whose families have been affected by the disease and have had family members unfortunately pass away. So I hope this just ends as quickly as it can.
Joanna, thank you so much for taking the time to talk to us today. We appreciate you. We love you. We want to do anything and everything to help you and other nurses, healthcare workers, all essential workers during this time. I mean, my heart goes out to everyone, and I really, really hope we can get through this time soon, fast. And thank you so much for taking the time to talk to us.
Thank you for having me.
Okay, so if you enjoyed this video, show it some love by liking it, commenting, and subscribing so that you never miss out on the latest celebrity interview.